All right, here we are. Good. So we're live. Okay, I guess we're live. Fantastic. Fantastic. Yay. So, anyway, welcome to Sunday Night Live and Monday Morning Live um, here on planet Earth. And anybody know what's happening on planet Earth? Let me know because I have no idea. No idea. Um, no idea. So, okay, good. Anyway, let's get going. So, as you all know, that this is we live stream every Sunday night in the U.S. It's in the middle of the night, unfortunately, in Europe, and but it's here over on this side of the world. Which is Asia, Eurasia, including Australia. It's morning, and it's Monday morning. So we're on, as you know, we're on all the channels except for TikTok, and so I mean we're on TikTok, but we can't live stream. All right. So anyway, all of them are at Dr. Thomas Lodi, except for X and TikTok, which are at Dr. Thomas Lodi, MD. All right, Alice. Good morning. Wow, we got on. I can't believe it. I'm glad some people waited, but here we are. So thank you all for hanging in there on my usual weekly demonstration of my absurd relationship with technology. Okay, so let's start looking at questions. That'll help. Well, by the way, the groups and I have three groups here, right? We have the health and healing group, which talks about everything from fasting to proper food, when to go to sleep, all those things, anything to do with being healthy, and how to restore it and how to maintain it if you have it already, and the second group is on parasites, and why? Because parasites are way more of a problem than I ever imagined. Even though through medical school, train and residency, and there was never. Even in infectious disease, in infectious disease departments, unless you were in tropical medicine, doing a rotation there or working in there. Good morning, Dwayne from Thailand. Yay. Good place to be in. So even in infectious disease programs, parasites were never, more than like an interesting thing that happens somewhere else. Well, they've become ubiquitous, and they're everyone's got them. They're being pulled. They're being pulled out of the sockets from extracted teeth. There's just the problem with parasites is beyond you're beyond belief. Anyway, so we have a parasite group, and then the third group is the CFC group. And chronically fermenting cells, CFCs, are how we refer to. If you press F4 and Alt, you go into first person. I don't know what that means. Anyway, so for the word for people call cancer, which is as a meaningless word, tells you nothing. It's our chronically fermenting cells. Anyway, we have a what do you call it? Okay, so we have that group. Now, if you have membership in the parasite group, you've automatically got a membership in the live stream, and if you have it in the CFC group, you automatically have membership in the other two. And the reason that's significant is that we meet weekly on a Zoom, not like this, where we don't really interact. In today, like today, what I'm going to do today is answer questions that have been sent in already, so that people that have, questions that arise spontaneously we won't be able to get into those, because, that's not the format. So, however, that's why we have the groups, and the groups really have replaced consultations. And the reason they've replaced consultations is that it was impossible to do all the consultations with people. It's just impossible. There's way too many people from all over. So, there's a weekly Zoom conference where I'm on, and we usually talk about something, whatever that issue is with regard with that group, whether it's CFCs, parasites, or health and healing, and then we answer questions. And I stay until the questions are answered. It could be 4 hours, 5 hours, sometimes it is. But it gives us a chance to interact. So when you ask a question, if I read a question here and I need clarification on a few things, I can't get it because we're not. All right. All right. Here, Joy. Okay, Joy. That's beautiful. Okay, so let's get to the questions, because that's why we're here. Okay, so the first question is from Becky, and it has to do with pancreatic CFCs. And she says, I know this question is totally off the chart. I have a little Jack Russell Beagle mix. He may have CFCs in his pancreas. We need your help. If you can help, we'll do whatever it takes. Just tell us what to do. Please try helping us. All right. Well, Becky, I have no idea how to work with a dog or animals. But I do know this. I do know that all animals live by the same biology as we do, and that is, in order to restore health and balance, we've got to supply all the biological needs. So that involves the proper food, etc. So I'm not a veterinarian, and I can't, unfortunately. If you've got pancreatic CFCs and you did need to get something like IPT for a while, I don't even know if there are veterinarians anywhere doing that. So I really don't know how to help you. I don't know how to give vitamin C IV to dogs or any of that. I don't know how to do that, and I'm sure there are veterinarians out there. So if anybody out there knows of a veterinarian that this woman could contact, that would help her, please do. Okay, because I just don't know how. Hi there from La Paz, fantastic, and Singapore. Yeah, fantastic. Okay. All right. So anyway, Becky, I hope you can get some help. I understand how you must feel. Marina, testicular CFCs. You guys still using that word? What's with why are you using astrological signs to refer to a condition that's happening in our bodies? Huh? Come on. Dean from Patia. All right, so Dean, so anyway, so testicular. Okay, so would you recommend using a magnet pulsar or pain relief? My husband, who has testicular CFCs, has been experiencing some pain in his neck. There's some conflicting research on PMF out there. Thank you very much. All right, Marina, regarding whenever you have pain anywhere, you've got to know. The first thing you have to find out is what's causing the pain, so you can relieve it. Is the pain due to compression from a lymph node that has involvement? Is the lymph node does it have any malignant cells in it? Is that what's going on, or is there something else going on? If you're talking about the pain in this neck, that could include some serious dental situation. So really, to seek out relief from pain is important. So now regarding PEMF, I don't really look at that as a way to relieve pain. Although there's a product called the Cloud, KLOUD, which is probably the premier, most important, and most advanced PEMF device out there. And if you look into the situation, you'll see that it goes way beyond what other PEMF devices do. So it deals on very fundamental levels, and it would help with pain. But again, like I said, if you've got pain somewhere, you've got to find out what is causing that pain. You don't want to just relieve it, because pain, like itching, like coughing, any symptom, and the way we define a symptom is something you experience, whereas a sign, they talk about signs and symptoms of a condition. A sign would be something that would be observable by a third party. So a doctor could observe it, or your parents or your friends. They observe a lump. They observe a wound. So that's a sign, right? And a symptom is something you're experiencing, which is pain, fear, swelling, things that you're experiencing, pressure. All right. So if you're getting a symptom, it's kind of your body's talking to you, and it's letting you know that there's something going on. And so it's really very important to find out what is going on so that you can deal with it. So yes, magnets and the PEMF can help with pain. However, if we don't eliminate the reason why that pain is happening, then it's going to keep happening, right? And this goes for everything. It's not just for this particular situation that we're talking about, not just for pain in some part of the body. So Marina, so I understand that your husband has testicular CFCs. So, I don't know anything else. There's a lot of questions I would be asking you if you were on one of the groups, So anyway, unfortunately, I wouldn't just jump into PEMF for pain. What I would do is the whole program that we always talk about, which is, eliminating all the possible causes for this to have occurred in the first place, the testicular CFCs, right? Which involves you look at biological dentistry, cleansing, lymphatic work, colonics. What are these guys talking about? What come on, you guys. Okay, so anyway, so I again, any symptom is a sign that your body is adjusting, adapting to something. You've got to find out what that is and eliminate the body's need to adapt. All right, whatever that is, you can't. Of course, you've got pain. You've got to deal with it. So there are many ways of dealing with it, right? Probably one of the most important, one of the most well, let me put it this way. Inflammation, chronic inflammation or acute inflammation. Inflammation is usually involved in most pain except for neuropathic pain, which is pain involving nerves. So other than that, usually inflammation is a major part of it. And remember, inflammation along with swelling, redness, and heat, pain, and pain are the symptoms of inflammation. Okay, so um, therefore, anti-inflammatories, which bring down the inflammation, would help. And what are good ones? Curcumin, boswellia, ginger. There's lots of botanicals that there's a product uh, that I often use for people, and um, it's called Bosmeric, Bosmeric. I have nothing to do with it. It's produced by a physician in New Mexico, um, Dr. Sunil Pai, but it's an amazing product, and it combines all three of those plus pepper, which improves absorption. Okay, so that's all. It's a very good product. But so we're talking about natural anti-inflammatories, because remember, inflammation is involved in most pain. Okay, so if you can at least quell that, then its participation in the pain is going to be eliminated. All right, but again, you've got to find out what's going on. All right, please keep that in mind. That's like a central theme everywhere. Now, so Marina, it'd be great if you and your husband perhaps joined the health and healing group. I'm sorry, the CFC group. Okay, so here we have another one. This is Brianna, and her question is, can I take fenbendazole and ivermectin at the same time? And the answer is sure and yes, and it's a good idea. I don't know why I don't know what your purpose is, but yes, often that's it. It's very important. For example, if you're working with if you are aware that you have parasites because it's obvious, you either find them in your stool or you have other obvious symptoms, then you want to make sure that you don't just disturb these guys so that they migrate to other organs. You've got to give them. What we usually do is you use 3 different anti-worms, anti-helminthics, and like ivermectin, fenbendazole, and maybe niclosamide. So we might put all of those together, or praziquantel, depending on what we suspect is going on. The other one is CFCs. If we know we know many of the relationships between parasites and CFCs, and then we don't know a lot of the relationships between CFCs and parasites. And what I mean by that is, if we look back to Dr. Weber in Munich, at the Max von Hoffenheimer Institute. If we look back at Royal Raymond Rife, and even back into the early part of the 20th century, and there's been many people that have identified some sort of parasite that's essential to the development of CFCs. That's pretty interesting. But that part we don't know about. We don't know about those. Rife called them the BX and BY. And I think the B was for bacillus. Bacillus usually refers to, when we're talking about a microbiology, bacillus is usually, like a round organism, as opposed to, E. coli, which is not round, but it's sort of a spheroid. So anyway, and that's what he did. He got the frequency for that, the BX and the BY, sent that in and killed the organism, and the CFCs went away. So we don't really know that the extent to which parasites and CFCs are related, but it's very, very important. So can you take fenbendazole and ivermectin? Absolutely, or mebendazole or albendazole, and you can take the other ones. you could take a niclosamide or praziquantel, which would give you a third antihelminthic, and then you'd want to get also an antiprotozoal like nitazoxanide, which is also called Alinea, or even tinidazole. So that's Brianna. Now from Eric. What are your thoughts on pancreatic CFC tumors and surgery to remove the CFCs, which has not spread, which has had 5 rounds of chemotherapy? Is surgery the only option? The CFC markers are almost negligible. Oncologist states that this is not uncommon with the type of CFC. They're pushing for surgery, however, I'm looking for reliable alternatives. Currently, looking at your protocols for parasites. I would like your insights. Many thanks. Okay, well, okay, so Eric, pancreatic CFCs that have not gone anywhere, they're still only in the pancreas. So again, this is why we need the group, so I could ask you a question, because I would think if it hasn't gone, or you haven't been able to determine that it's gone anywhere, because that's the problem with pancreatic CFCs. By the time you find them, they're already usually spread. But so if it's in the head of the pancreas, which is right up to and touching the small intestines, the duodenum, where the duct from the pancreas goes right through into the duodenum. So if it's the head of the pancreas, it's going to, and there's any growth of the tumor at all, it's going to affect the bile ducts, biliary. People will get very jaundiced, turn yellow, and there's a loss of that. It's a very difficult thing to go through. So what usually happens in a situation like that is a gastroenterologist will put in a stent, and that is they put in something into the bile duct that's being blocked because of the tumor in the head of the pancreas, and they relieve that pressure, restore the flow. The person's no longer yellow, and you can commence with working on it. If it's in the middle or the tail of the pancreas, it could have other organs like the spleen, the intestines, so it's right there in the middle of everything. And that's probably, that is the reason why pancreatic CFCs are so difficult to deal with and why they have such a bad reputation, because of their location. They're right in the middle and close to everything. So you can always get, I get distracted by reading your guys' comments. I got one for you. Parasite related or not, it could be. Okay. Laparoscopic biopsy. Where's the proof? Well, I'm not sure what you guys are doing. Are we like gonna? Oh my God. Okay. You guys, listen, you got to join these groups so that we can have conversations. I can't have a conversation with you right now. All right, please understand that. I hope you're listening, because I don't think anybody is listening. I just see people writing questions and talking to each other about things. All right, so with pancreatic, again, like all CFCs, remember the difference between one CFC, between having ovarian, pancreatic, colon, breast, lymphoma. The difference between all of those is the location. Other than that, it's the same biological process going on, right? It's called the Warburg effect, which is also called aerobic respiration, which is aerobic glycolysis, which means that in the presence of oxygen, it's fermenting. Because normally, if a cell has a cell that does have mitochondria, that is a more developed type cell, if it's got oxygen, it will make energy through the mitochondria and will not be fermenting. So if a cell that has those structures, it's a higher cell like the ones we have in our body, is fermenting, in the presence of oxygen, that by definition is what they call the astrological sign, and we call chronically fermenting cells. All right, so the difference in all of these in the different locations is the location, right? So the fact that the pancreas is located right between many structures. I mean, on the tail is the spleen, and part of the adrenal gland, and then you've got over here you've got the small intestines, and then this is this, and on the head you have the duodenum and the liver and the gallbladder, and then on the top end of the pancreas you've got the stomach. So it's right in the middle of all those things. So that's why it can cause many problems. And whereas a tumor that was on the breast could actually grow 2 or 3 centimeters, still be a stage 2 and not affecting any of the other organs or functioning of the body. But pancreatic, it's not so. If it's occurring in the brain, it can't be too much growth, because you'll have problems. So anyway, that is what's going on with pancreatic. So what do you need to do, Eric, is, or if it's someone that is immediately find and that's what you're asking me for. Now they're pushing for surgery. So the surgery that's usually done in pancreatic CFCs is called the Whipple procedure. And that's more for the head, if it's in the head of the pancreas, because it's actually causing problems. It's really blocking, the person's turning yellow. It's blocking their liver and bile system ability to function. And so what they do is they actually disconnect the stomach from the duodenum, where it flows into. Normally the duodenum is the first part of the small intestines. So you chew the food, you swallow it, it goes down your esophagus into your stomach. There's some processing going on there, and then it leaves the stomach and goes into the duodenum, where it's going to get help by the liver, by the gallbladder, and the on upper side and the lower side of the it's going to get help by the pancreatic enzymes for digestion. Let's turn off this for a second. So in the Whipple, they take out, they disconnect the stomach from the duodenum, and they reconnect over, so they bypass the whole duodenum, and usually connect into the ileum or the jejunum, which are the lower parts of the small intestines. That's a Whipple procedure. So what's the problem with this surgery? There's many problems. Any kind of surgery we know is going to it's going to increase the spread of the CFCs. It just does that. There's a lot of literature there, and I could quote that easy. I mean, I could show it to you if we were on a group. What I would do right now is be able to share on Zoom, and I could show you some studies. That would be that'd be great for you to see that, right? So, but in this format we can't. But anyway, the surgery will do that. Number one. Number two, the surgery is trauma. It's surgical trauma, and the body then is dealing with the trauma of healing and all that, rather than dealing with CFCs. So what we look at it is, unless the tumor is causing a problem that's going to a life-threatening problem, like it's threatening your ability to breathe, your ability to eat, to have bowel movements, or anything like that. Under those circumstances, you have to remove it. However, if it's not, then removing it won't really help. Okay, and it will probably make it worse. So now, if we're looking at the Whipple procedure, so what you are left with is a person who no longer has use of their duodenum, which is so essential in appropriate healthy digestion, because it's in the duodenum. That's the first part of the intestines where the food comes out of the stomach. Okay. That's where all the enzymes are used, lipase, amylase, the proteases, and all that to help digest the food. That's where fat is being absorbed. If there's any fat in the meal, anywhere from an avocado to whatever fat you're eating. And so that means you're getting access to the biles, the gallbladder and the bile, and also the pancreas, like that. So all the food is actually processed down to and broken down to simple molecules that can now be absorbed, and most of them are absorbed in the ileum and the jejunum. But if you've bypassed it, you've gone from the stomach, which you've disconnected from the duodenum, and you've bypassed it, and you're now in the ileum or the jejunum, you've lost that part of digestion. So you're going to have to make sure that the food you're eating is going to be suitable for absorption. So it becomes a very complex situation. So to avoid surgery is very important. So you'll need some help, Eric. I don't know where you're located. And unfortunately, you have to be careful with even alternative doctors, because a lot of them are just not well trained. So again, I don't know where you are, Eric, but the first thing you've got to do, or the person that that has this condition, is get to a real certified IAOMT certified dentist, biological dentist. Get evaluated and make sure that you've eliminated all the potential dental causes of CFCs. And then you need to do cleanses, and there's a whole there's a group of protocols that we would use and recommend. But it's basically the foundation of all of it is this. Okay, what are CFCs? These are cells that have lost, for 100,000 reasons, have lost a functional use of about 60% of their mitochondria, which are the little organelles inside of the cells that make energy. They take 6 oxygen molecules and 1 glucose, and they make 36 ATPs, and you've already got 2 made in the cytoplasm, so you wind up with 38 ATPs. All right, so it's a very efficient mechanism, right? 1 glucose will give you 38 energy molecules, packages. So when 60% of the mitochondria are lost, the cell has, in order to stay alive, to meet its energy requirements, it's got to ferment. That is the only other option. There's no other way for a cell to make energy. So in order to ferment and be successful at it, it has to silence this gene and that gene, and wake up this gene and all that. So it changes it's called genetic expression, the different parts of the genes that are being utilized by this cell. And that's normal, right? We all know that the liver cell is not going to be doing the same things that the kidneys are doing. So all of the kidney and nervous tissue, brain, and all those aspects of the DNA are silenced in a liver cell, because it's just all that's going to be turned on is the ability to do what livers do. I mean, this is obvious. All right, so you've got to do this cleanse, which involves colon hydrotherapy, lymphatics, many things, and you've got to also be able to work with the mind, because the mind, remember, can override all all the things that you're doing that are health, that promote health, all those things can be completely um, turned off and eliminated by fear. All right, and fear is the way this whole system works, the Rockefeller system that we were born into. Um, it works with fear, and it's the standard of scare. And they scare you into submission. They scare you into doing things. Okay, now so that the thing that you want to do is just not listen to them and not just be scared because they use the word cancer, which means nothing. It means nothing. There's no definition of it other than what they've given it. They've made it up. I mean, there's no other meaning. It has no other meaning um, other than an astrological sign. So it doesn't help us at all. But the chronically understanding that these are chronically fermenting cells and that they happen because of an accumulated toxicity that has resulted in loss of 60% of the mitochondria. Wow, well that gives us a lot of very relevant information. Now we know let's get rid of eliminate all the possible causes of toxicity, right? And if we can do that, then we can prevent it from continuing to happen, to continuing to grow, right? So that's essential in the whole healing pathway. The second part of the process would be using um, botanical non-toxic substances, including ozone and peroxide, but curcumin, vitamin C, quercetin. There's lots of intravenous therapies um, that are specifically will eliminate the current CFCs you have, but will not harm the healthy cells that you have, which is very important. Whereas chemo and radiation and the other standard therapies um, don't distinguish between healthy cells and CFCs, and you wind up in trouble. All right, so that's that. And then the third thing you need to do is to get the immune system woken up. All right, so and we can walk you through. We can help you with that. They guide you because that's what we do. But it'd be really helpful if you got in the groups because I can't do that here. So, but number one, wherever you are, whatever's going on, whatever they've told you, you've got to forget that. Now, in your situation where you said that the tumor markers are negligible at this point, so I would want to know other things. I'd want to know what the ferritin to iron ratio is and what the actual numbers are for the ferritin and iron, and the LDH, thymidine kinase. There's a lot of other indicators other than biomarkers, other than what we call tumor markers, that can help us understand how the person is doing and dealing with the situation. So you're going to need a lot of guidance, Eric, and I don't know where you are, and just join the group so that we can talk further because it's important, all right, so now this is Denise. From Palm Springs is regarding lymphomas. So it says that for someone with lymphoma wanting to cleanse the colon with colonic, will it be okay if the swollen lymph nodes are in the pelvis area? Yes, absolutely. I mean, regardless of where they are. I mean, so you've got swollen lymph nodes in the pelvis area, and you're going to need to, and you still want to do colonics because actually, where is it? So understand this: the reason to do a colonic, right, is to eliminate the toxins in the colon, right? That's the obvious reason you're doing it, but which is by eliminating the toxins that are in the colon, you're eliminating a big sewage splash that occurs every 4 minutes from colon to the liver, right, which is going to really impair the liver's ability to function. So there's there's multiple reasons for cleaning out the colon, and since that's essential to healing, then the answer is obviously yes, because the lymph nodes are involved as part of normal physiology and normal physiology, right? Because 10% of all the waste products and other products that occur in the cells that are excreted, 10% of them go through the lymphatics. 90% go through the veins back to the heart and get circulated. But 10% are lymphatics, and so it's very important that we keep the lymphatic drainage system working and all that. So the first part of healing is to cleanse, all right? And it's something that you need to be doing all throughout the process, because we need to always be cleaning. Just like you have to make your bed every day, you got to wash the dishes. You've got to do these things because just daily use is, if you didn't do that, if you didn't make your bed, and you didn't do the dishes, and you didn't empty the trash, within a week or so you'd be in trouble, right? So the answer, Denise, is absolutely, because it's going to help with the entire process of healing. And also, if the colon is in any way, because if the person happens to be very constipated, it could actually be blocking and causing problems to the lymph nodes. So anyway, yes, the answer is yes. You can absolutely do that. Here's Denise again. My mother was recently diagnosed with lymphoma stage 2. Her doctor requires a biopsy to determine the CFC type. No treatment plan has been offered until biopsy. We have major concerns with the biopsy due to potential spread. Is a biopsy necessary? What are alternatives? Well, Denise, according to me, they're not necessary. According to the world of oncology, they are necessary. And the reason they claim that they're necessary is that because unless they get a biopsy and they send it to the pathologist, who then looks at it with a microscope and determines and describes the microscopic anatomy, which really just tells you the origin of the tumors, where they started. The claim is that that's going to give them a direction on treatment, and that's literally not true, because chemotherapy and radiation are going to be used on everybody. They're standard for everybody. So which chemotherapies? Well, they're going to look at the ones that have gotten the latest FDA approval, and usually and some combination of that. So keep in mind that excuse me. Okay, the way, let me say it this way. When Dr. Donato Perez Garcia, the physician, the Mexican physician who figured out IPT and actually invented it, when he first was dealing with a person with CFCs, back in those days they didn't have chemo, and so the only poisons that he had access to were arsenic and mercury. So using the insulin in the way it's used, you wind up targeting CFCs because they have more insulin receptors. And he didn't use chemo; he used whatever they had available. It might have been mercury and arsenic, like he did with tertiary syphilis. But anyway, that woman went on to visit Dr. Donato Perez Garcia's grandson, who was also a physician, like 40, 50 years later, and with other complaints. All right, so the reason they're saying that all these drugs are specifically for this type of CFC, because you already know there's no type of CFC, there's only CFCs. And the only difference between them all is location. So that whole idea of type is wrong. All right, but assuming that's correct, then they're saying that this group of or combination of chemotherapies would be good for this type. That whole once you start going down that path, it's not a true path anyway, because the reason that would be an issue is there's cells can become resistant, and what it means that they become resistant is not that they can now the poisons are no longer poisons to them. It just means that they've developed the ability to eliminate this toxic treatment quicker than you can get it in, and so that it's called resistant. All right. So one of the beautiful things about IPT is you're using the chemo is going in through the insulin door, or one of the doorways that insulin opens up, rather than having to go through the normal processes. So the cell cannot eliminate the insulin because the relationship it has with insulin, because that's how it lives, right? That's how it gets its nourishment. So it can't eliminate its insulin receptors and all that. So that's the beauty. One of the beauties of IPT is that you'll be able to get into and target directly the CFCs and not hit all the other organs. So with regards to lymphomas, as you probably know, they divide them into two groups, which is kind of silly, Hodgkin's and non-Hodgkin's, because Hodgkin's is one particular histological type, which is basically does the lymphoma have what's called a Reed-Sternberg cell or not? Right. That's all. And then all of the non-Hodgkin's lymphomas, there's a lot of them, but that's one category: non-Hodgkin's lymphoma or Hodgkin's lymphoma. And so they have differing regimens of chemotherapy for those different lymphomas, just like they do have multiple different chemotherapeutic protocols, regimens for breasts, ovaries, colon. And what the oncologists typically do is they'll pick a combination that they've had, I guess, some success with or familiarity with, or they're just trying to please a drug rep. They'll use that, and if it fails, then they'll go to one of the other protocols that have been established by the American Society of Clinical Oncology, or actually start looking at different types of other kinds of therapies. And the only other therapies that are really available in oncology are like the monoclonal antibodies and what they call immune therapies, which are really not immune therapies. They're just blocking a certain part of the immune system. So, but anyway, doing the biopsy is not essential and potentially dangerous. And I don't require biopsies. Now this is, Denise again. Wow. Okay, Denise, I hope you got the message that I would, if unless she's in a situation where she impending, blockage of her intestines or something serious like that, I wouldn't get the biopsy. Because of potential spread. Okay, this is Timothy, and I was recently
told that I have a small milky substance on my larynx and that the doctor says that it may be a precancerous. I've been a lead singer in a rock and roll band for over 40 years, and I'd like to get my singing voice back, so I'm hoping I can do this with ivermectin and I guess that's fenbendazole is all my singing voice back. So I'm hoping that I can get this with ivermectin and bend is all. And is there anything else that I need to be taking and how much and often? Okay, listen. Timothy. So Timothy, yes, there are, and you might have heard me a moment ago speaking about the need for the biological dentistry to find out because there is a direct relationship between teeth and organs in our body and what happens to those organs. A direct, specific, and relationship. And so you've got to have a biological dentist. You've got to do cleansing, which involves juice cleansing and or fasting and many things. And to go over all of it at this point would we've done it many times. So what I'd recommend is going to our website, and we do discuss the basic overall fundamental plan. But I would absolutely at this point join our CFC group so that we can have basically a consultation, right, weekly, not just once, right? Okay, so Timothy, it sounds like you probably have not been visiting us here on these live streams very often. You're probably new to it, but there's a lot of that you can be doing, and I'm glad you're here. And let's get started on it. But it always starts with a cleanse. You've got to clean out the toxins before you get started with any kind of what we call treatments. Okay. Now this is Jada, and she's saying ALS is unknown. ALS is unknown, called parasites cause, possibly, maybe, in the teeth, over 30 years of parasitism. All right, so I guess ALS, you're talking about Lou Gehrig's, right? Amyotrophic lateral sclerosis. I'm assuming that's what you're talking about. Okay, and you're thinking of doing a parasite cleanse to help with that. Well, parasite cleanses are going to help with, again, like almost with not almost with every CFC look, regardless of the location, because part of cleansing and getting rid of toxins is to eliminate parasites, which can either directly or indirectly contribute to the CFC, not only emerging in the first place, but continuing to spread and grow. So the answer is yes. We do have experience in these, and at an Oasis of Healing in Arizona, which is where our center is, we'd be very happy to help you and work with you on this. All right, so now ALS, ALS is considered a neurodegenerative condition. Okay, neuro meaning nerve, degenerative meaning wasting away condition. And there are other ones like Parkinson's, Alzheimer's, what we used to call mad cow. And basically, there's an overall senility, a generalized senility. So And then there's MS. I'm sure you've heard of MS. Now, often what you'll find is that the neurologist will disagree. One will say you have ALS, where another one will say you have MS, and or another one will say you have Parkinson's. When really, why? Why would there be a confusion there about what to call it? And that's because the whole idea of diagnosing, and in other words, that's putting a name on a situation where, what are we putting a name on? We're putting a name on an adaptive process by the body to a situation that's not meeting the person's biological needs, and so it's adapting. And this may be a very convoluted, long set of adaptations, which is where you wind up with, when you eventually get CFCs. It's not the first adaptive process that goes on along that pathway. So, um, now, ALS is thought of as an inherited condition, um, and and if you've got the genes and you're going to get it, that's it, right? And it was also thought of as a condition that is basically untreatable. Well, we found out that neither of those are true anymore. What's being called ALS, in other words, the criteria to name these, calling it ALS and all that, and MS, etc., is changing. These are all changing. So what I'd like you to realize is there's no such thing as ALS or MS or any of that stuff. These are names they put on different processes that are going on. All right. So and all these are these processes are related to toxicities, varying types of toxicities, and that's just simply what it is. So what do we have to do? We've got to start out by eliminating toxins. So whether or not you're talking about a neurodegenerative condition or you're talking about CFCs, it doesn't matter. You've got to always start with getting rid of the toxins so that you can begin for the healing. The healing needs to take place, right? And healing is restoration of balance, of functional balance called homeostasis. 1 second, please. Excuse me.
Okay, sorry. Here we are, 1, 2, 3. Yeah. So ALS, MS, other neurodegenerative conditions are variable. There's no it. And I think one example that will help you understand that is when I was practicing in New York, there was a woman who was a CPA who came in, and she had a flu shot the year prior. And right after the flu shot, like within 24 hours, she developed flu. She was talking like that. It lasted about 3 months and gradually got better. For some reason, the following year, she got the flu shot again. And this time it wasn't going away. So she came to our center, and she had been to several, this is New York, she had been to several of the top leading hospitals that are famous in New York, and got different diagnoses. Some people were saying she had ALS, some people were saying she had MS. So my point is this, is that these are not things that exist. They try to label it, whatever it is, whatever the impairment that you've developed. They try to they have criteria for labeling it as something, and then they call it becomes this thing, whatever it is, whether it's CFCs, diabetes, a neurodegenerative condition, heart condition, whatever. They want to make it a thing that they can now have a treatment program for. And this situation clearly shows that that's not what happened. You know, I had another fellow in New York around the same, a couple of years earlier, who had a flu shot and was unable to stop moving until he went to sleep. And I mean, like it was. I can't imagine what he was going through from having had a flu shot. So, what are you going to say about flu shots, right? And if they work, why do you have to get a new one every year? Okay, so that is an obvious rhetorical question. And here we go. We're going to clean my glasses. So, okay. Now, so Jade, what parasites are most likely involved in your situation, just like they are in almost everybody. Okay, and to what degree and all that, it's not always clear. But but as part of your detoxification process that you need to do, for sure, to begin, is going to be a parasite cleanse. Is going to involve a parasite cleanse. So yes. But remember, there's never like one thing that caused it. What caused my blah 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 blah. Well, a multitude of things in confluence caused it. Now, this is from Min, and the topic is prostate. CFCs, please, you guys. Use the word CFCs. Which anti-parasite medication would help shrink and enlarge prostate? Okay, now, I would encourage you to join either the CFC group or the prostate group. I mean, or the parasite group. We had a woman who was in the group, our group, early on. Anyway, she in one of our groups, she showed us all the PowerPoint of what she did with her father, who had an enlarged prostate that they were calling prostate CFCs. and she started him on ivermectin, fenbendazole. I can't remember her specific regimen, but small worms started coming out and large ones, and she showed us pictures in her PowerPoint, and actual video clips of in the bathtub where there was these incredibly long. I mean, I'd say 10 centimeter, worms, and she kept. I can't remember if she rotated them or not, the anti-parasitics, but the prostate went back to normal, and all these worms came out. So, whoa, can they be involved? Yes. And the anti-parasitics, you don't think of them to shrink the prostate. You have to realize what they're doing. Okay. Remember, most of these anti-parasitic medications, the reason they work with CFCs is they turn off certain pathways that parasites need to survive, and that also CFCs need to survive. So, when you're getting an anti-parasitic, can actually help, can stop CFCs. That's why they're called repurposed drugs, right? Because the original purpose was for parasites. Now they're finding a new purpose. But ivermectin, fenbendazole for sure, and at least, and then maybe niclosamide would be 3 to start with, and you'd want an antiprotozoal like nitazoxanide. But for an enlarged prostate, there's lots of other things that contribute to that. One is diet. Eating dead animals greatly contributes to that. You've got to check the biological dentistry and the relationship of the mouth oral health to the development of an enlarged prostate or CFCs. And then with prostate in particular, or with prostate, there is one of the main reasons why a prostate starts to get enlarged as men get older is that they have less and less testosterone, so they lose both their libido and their sexual ability function, and therefore they don't have sex, and they don't have ejaculations. And what has been found is that 21 ejaculations per month is like you must have that, at least that, to keep your prostate well drained. Otherwise, it will get congested, and that's just what has been found in the studies. It's not my idea. Now, this is from Marilyn, and she says, my dear friend has been diagnosed with a tortuous aorta. They said it's twisted and he needs a stent to allow the smooth flow of blood. He also has an abdominal aneurysm. Are stents the only option? Well, Marilyn, a tortuous aorta means that, well, what the aorta is that it's the main vessel that the heart pumps the blood into to begin the flow around the system, the body. So just as a kind of a quick tutorial on how the circulatory system works, all the organs all over the body, the blood flows into them through the arteries, and then little arteries, arterioles, and capillaries, and they're drained through the veins, 90% of them, and 10% through the lymphatics. So the veins come back to the right side of the heart, which then pumps the blood into the lungs, where it eliminates the carbon dioxide and brings in the oxygen. Then that goes back to the left side of the heart, which then pumps it through the aorta. Okay, so the aorta is the main large artery that comes out of the heart.
And off of it are branches of all the other arteries. So to have a tortuous one, it means that it doesn't come off. Normally, the aorta comes off. If you have the heart here, then the aorta comes off this way and then down. So it may be that it twists around, or anyway, it's going to impede. Obviously, it's going. The more turns and twists and convolutions it has, it's going to decrease the blood flow and the efficiency of circulation. And there really is no other way but to put a stent in to keep open. So if it's tortuous such that it's kind of bending in on itself and it's blocking blood flow, then you're going to need a stent. And a stent basically is, I think you all may know what it is, but it will go inside of a vein or whatever structure, and it expands outward like that to keep it open so that you can maintain blood flow. And he's also got an abdominal aneurysm. So what that means is that you, after the tortuous part of the aorta where it's taking off from the heart, then it goes down to into the deeper into the abdomen, chest, and then abdomen, and goes straight down, and then has branches off to different parts of the body. So if there's an aneurysm there, that means that the vessel wall has become thin, and it's much like if you've ever seen like a tire that's lost it's kind of worn out in one area where the rubber is kind of worn out, and then you get like you get a bulging out of the tube that's in the tire. Anyway, so it's the thinning of the wall is what an aneurysm is. And when you get that aneurysm, you can get bulging out from the other layers of the tissues, other than the top layer on the aorta in this case, or any vessel. And those can break, burst open, and the blood can be spilled, and a person can hemorrhage. So they're very serious. But the fact that there's a tortuous aorta and aneurysms tells us for sure that he's not getting enough selenium, because selenium is usually related to aneurysms. And remember, 4 Brazil nuts is going to give you 200 micrograms of selenium. And it's good to get about 400 to 600 micrograms a day. So that's one thing you can think of. Other than that, in this case, the stent sounds like it's the way to go. With the aneurysm, sometimes what they'll do, and I don't know if they've offered this to you, that they'll go in and kind of, just like they patch a tire, they patch over the aneurysm so it's not bulging out. There's no chance for it to rupture. So they do those things. I'm not sure what your situation particularly is, but that would be the other thing for the aneurysm part. But for the tortuous aorta, you're definitely going to need a stent. Okay, so this is Philip, and the question is, hello, I had lymphoma of the mesentery successfully treated with R-CHOP, which is a chemotherapeutic regimen, about 4 years ago. So we were talking before about the Hodgkin's and non-Hodgkin's. So the non-Hodgkin's, they usually use this particular protocol that he wrote there called R-CHOP. And those are just names of the first letters of, the different chemotherapies involved. And recently, he goes on to say, recently I had most of a sizable tumor in part of my small intestines surgically removed. Pathology determined that the tumor was benign. So the question, while fenbendazole is effective on CFC cells, will it work on abdominal benign cells? I still have 20% of my tumor inside because it's inoperable due to intermingling with blood vessels. Question number 2 is fenbendazole used as a preventative measure against CFCs? All right, so the first question was, we know that fenbendazole works with CFCs. Will it work on a benign growth? And the answer is whether or not it will specifically. It doesn't shrink a tumor. What it does is it turns off certain pathways that tumors need, metabolic pathways that they need to survive. So if you've got a benign tumor, then you're not going to have the same pathways that are turned on that you would in a malignant tumor, because it can be a benign and malignant tumor. So again, even if it's a malignant tumor like Joe Tippin's, it wasn't that the fenbendazole had any direct effect on shrinking a tumor. What it did was it worked by blocking certain specific enzymatic pathways that the cell needs for survival. And to whatever extent this benign situation you have going on has those and other pathways that might be in use, yeah, that'll help, of course, but we don't know exactly. But since you probably need to do a parasite cleanse anyway, like we all do, it's definitely something that I would recommend. And so the second part of the question is fenbendazole used as a preventative measure against CFCs? Well, no, it's generally not used like that. Okay, because generally, yeah, it's not used. It's used usually either as part of a parasite cleanse, or if it's used for CFCs. You know, as we've been saying. So I would absolutely continue with the fenbendazole. I would make sure I'm getting some ivermectin and probably niclosamide. And regardless of what name if they're having a hard time putting a name on it, that's okay. But we do know that they considered it a non-Hodgkin's because of the R-CHOP treatment. So this is Dina, and she says, currently experiencing fungating ulcerated tumor to left breast that bleeds occasionally. Diagnosed in 2020. So diagnosed in 2020 and no conventional treatment done. The tumor seems to be growing more rapidly than normal in the last year due to extreme emotional and physical stress. The tumor is twice the size of the breast. The biopsy is what's causing fungation. Regret doing breast and lymph node biopsies. Axillary biopsies has caused nerve damage and very sick and lack of mobility. Would you recommend doing a poultice or naturally active to naturally shrink the tumor? All right, so so you've got a fungating tumor going on in the breast. Again, I hope, Dina, that you've gone to a biological dentist, a real one, because that's there's so it sometimes can stop you're done from that, right? Now, you say it's been growing, due to emotional and physical stress. So sure, we know that stress will do that, especially emotional stress, which will turn on the adrenal glands, and they're going to pump the body full of cortisol and adrenaline. It also changes the autonomic nervous system. In fact, all the changes that occur as a result of stress are prevent healing. So yeah, that's got to be dealt with. So the answer to one of your, the partial answer to your question is, like, so your question in the end was, would I recommend doing a poultice or naturally shrinking it? So, well, I would, before we even think about that, I would eliminate all biological dental potential. Essential thing to do. You've got to do it. Then we got to do juice cleanse for at least 3, 4, 5, 6 weeks. Colon hydrotherapy, all those things to detoxify the body, and then to detoxify the mind. We have to learn to shut up for a while, to stop thinking, and that's difficult to do. Right? It's called meditation. Because thinking in the first place is not a voluntary process. You don't decide to think; it happens to you. So, a very important aspect of cleansing the body is also cleansing the mind. And the way you cleanse the mind is that you eliminate certain words and you use other words. All right, so you've gotten rid of the toxic words. So it's a psycho spiritual familial therapy, basically working with linguistics. So we don't use those words like astrological signs. There's many words that we're careful about using. So any word that's going to support the whole concept of diagnosis, like treatment, diagnostic testing, we're looking for the histological type or whatever they're saying, is yeah. You have to eliminate from your mind, because the problem is if you accept the fact, if you're going to call it that word, then remember there's no definition of that word really. That's why we call it CFCs, chronically fermenting cells. But since there's no definition of that word, we really don't know what it is. So if you ask somebody, you can ask 5 different oncologists and probably get a slightly different answer. I don't know what it is. Depends on many things, but there's no definition of it. What they say is that these are rapidly proliferating cells that are immortal, meaning that their telomeres don't shrink, so they don't stop dividing. But again, it's not it's a description of partly of what's going on, but it's not telling you anything. Whereas the concept of chronically fermenting cells is exactly what defines it. So it's
it's the cellular response to a situation where it's not meeting its biological needs, right? So that's really telling you what it is. So now you really know what you got to do is just eliminate the reason why the cell is responding that way. And it's responding that way because it's been toxic, intoxicated with the world of toxins we live in, and there hasn't been adequate nutrition, movement. There's a variety of things that go into a healthy lifestyle that have not been happening, which is why this developed. Hormones, especially with breast, needs to be balanced, not blocked, balanced. Okay, because remember, if you have a hormonally related CFC, because it's in the prostate, it's in the uterus, the ovaries, or breast, then reestablishing hormonal balance is absolutely essential. It's essential for everyone anyway, but even more specifically here. So that's a major part of it too. So in addition to cleansing and changing diet, going to sleep early, and eating healthy, and meditation, in addition to all that, and remember that involves, it's everything from the time you go to bed, which should be no later than 9 p.m. and you should stop eating 5 hours before you go to sleep, which means your last meal would end at 4 p.m. if you're going to bed at 9. And since you want 18 hours between your last meal of one day and your first meal of the next day for many important reasons, that means you could eat again at 10 a.m. So you stop eating at 4 p.m. and you eat at 10. So from 10 to 4 every day. That's a lot of food. So you definitely won't be hungry in the real sense of the word hunger. So Dina, I would really encourage you to join our group too, CFC group. So this is Janie. Says, do you have 24/7 service, and will you prescribe medications? All right. Well, in the United States, our center, it's called an Oasis of Healing in Arizona. It's been there about 20 years now. We're not 24/7. We actually close in the early evening, 5, 6. So, and if you were a patient there, they would prescribe the medicines that you need, which would include what you're talking about here. And well, not even sure, because you don't refer to it in any way. You just say, do you have 24/7 service, and will you prescribe medication? So no, it's not 24/7, but if you were, for example, to call tonight at 6 or 7 p.m. and there was no one there, you would get a call back the next day. Or there's, if you on the website at oasisofhealing.com, you can find other ways of contacting us. So 24/7. So, and we don't have 24/7, but we do prescribe medications here. And with everybody, it's part of that is the anti-parasitic medications. That's an advertisement. Want to get more clients and customers. Wow. Most of these questions are not about CFCs. Most are about parasites. Isn't that amazing?
Yeah. Okay, so this is Diana, and she's saying, "Hi, Dr. Lodi. I was a patient at an Oasis of Healing in Arizona last year for 10 weeks, and thanks to God's grace and your amazing caregiving there. I'm in remission from my brain tumor. I've been on the anti-parasitic and anti-fungal protocol since leaving and would like to know how long I should continue these plans. I'm taking many different supplements throughout the day, but I'm very interested in getting your take on boy, these are hard to read. So, okay, so you wonder if you're taking too many medications. You're also continuing with treatments like hyperbaric oxygen therapy, high dose vitamin C, IVs, ALA, glutathione IVs. All right, so now I know there's a follow up program. Are you getting a chance to follow up with the doctors now that you've left? Because that's part of our program to help you with that. But if okay, so I don't know the condition here, Diana, of regarding your tumor, your brain tumor, the brain tumor. Um, I'm assuming it's a you know. Okay, so I just don't have. So you were at Oasis. Had you had surgery? Had you had radiation? Um, and what was left when you left Oasis? What was left in your head? Are you taking medications like dexamethasone to keep it shrunk down, or, from the edema forming and causing problems? Um, and you're taking lots of supplements, right? And you want to know basically is can you cut out some of them? And the answer is um, most likely you could, but I don't know your situation. So my advice would be to call over and ask to speak to either Dr. K or Dr. Bardwell, right? And find out. So, but you're continuing with hyperbaric oxygen and high dose vitamin C. That's fantastic, and ALA, etc. So, so I'm assuming you don't live in Arizona, or maybe you do, and you are still seeing them. I just don't know. So I don't have enough information, Diana, to let you know. Yeah, most likely you can reduce some supplements, but we would need to talk. So Diana, join the group, the CFC group, and we can have ongoing consultations, basically. But other than that, I mean, I don't even know the specifics to answer specifically. All right. What happened here? Wait, did I lose connection here? Hello, hello, hello. Oh, it seems good. Okay. I don't know what that. I don't know why it said that. um, I have This is from Janie. I have a bad infestation with porkworm with large lesions on my face. My health is decreasing fast and can't find help. Is this something your group can help me with? I'm running out of time. Yes, it's spreading so fast. I don't, that doesn't sound like tapeworm. So, yes, Janie, join the parasite group like today. And let's get into this because that does not sound like parasites. You say it's spreading fast on your face, and you know, pork tapeworm doesn't usually manifest like that. So please, yes, the answer is yes. Join the group as soon as possible. Let's deal with this. All right, you guys, I started late. I apologize 1,000 times. And I don't want to keep you late because I know it's super late for a lot of people. I mean, it's so late that it's actually early morning for some people. I sincerely apologize for not being able to get started on time. But anyway, we did make it, and we got some questions answered. And again, listen, for all of you who are asking me questions here, they're beautiful questions, and I'd love to get into them. I mean, you would, okay, Patricia, you'd like to join the group, just go to drlodi.com, and then you'll be able to, drlodi.com, my website, and you'll be able to, and you'll find the groups there, and you can join any one of them. And please do so. We can have ongoing discussions and teachings, and then you have access to other kinds of articles, etc. So Trent here is asking me, do you have to be a subscriber to get your question answered? No. All you have to do is go to the website, drlodi.com, and you can ask the question there. And I think on Instagram there's a place to answer it. And I think on Facebook there's a place to answer it. A place to ask a question. But no, you don't have to be part of the group, right? You're welcome, Lori. Thank you for always being there. There's a good diet. Gregory Madison. All right, you guys. Patricia. Oh, I see. You lost up for a few seconds, huh? Yeah, I know. It's weird. So Cheryl, join the other group. You don't have to join the CFC group necessarily. You can join the parasite or the health and healing group. Anyway, you guys, thank you so much. And make sure no Thai honey pot is slipping you any drugs. Make sure no Thai honey pot is slipping me any drugs. Okay, good idea. I'll make sure of that. How much does it cost to stay at the clinic? Huh. All right, so call an Oasis of Healing because it's a day, it's an outpatient program, so you'd be staying at either like an Airbnb or some sort of hotel or something, and then you would be attending the clinic. So, but the costs would depend on the program that you'd be in and all that. So, really, and oasisofhealing.com is the way to get to it. Anyway, Sawadee Kap, aloha, and thank you very much. See you next week. And what do we do with this? We do that, and then, yeah, there we go. And then, so.